As now we're going to turn to the pandemic. Tonight, Michigan once again has the highest case rate of COVID-19 in the nation.
Concerning numbers, to be sure. The CDC says we landed in the top spot after more than 50,000 new infections in the last week.
The Henry Ford Health System announced today it has seen a 60% increase in people being admitted to the hospital for COVID-19 infections since the end of last month.
It's a trend we're seeing across the entire state, which made us ask, well, what has changed in the last 365 days?
Well, on this date in 2020, there were approximately 6,381 new confirmed cases of COVID-19 here in Michigan. A year later, it's actually gotten worse. Just yesterday, more than 21,000 new infections were reported over a 3-day period, an average of more than 7,000 a day.
The number of COVID-19 related deaths also appear to be trending in the wrong direction. But while the case rate hasn't changed, the restrictions placed on businesses and people because of COVID have.
On November 15, 2020, the governor was shutting down restaurants and imposing new restrictions. A year later, a sold-out crowd watched the Rolling Stones live in concert at Ford Field.
These troubling numbers have some saying the governor and the state are not doing enough.
So 7 Action News reporter Kim Russell reached out to get some answers for us.
Not a stay-home order, but it is geared toward limiting indoor gatherings.
This was the scene 1 year ago this week. Governor Gretchen Whitmer announced restrictions forcing high schools and colleges to go virtual and restaurants to offer takeout only. At the time, we averaged about 6,381 cases per day. This week, Saturday through Monday, we averaged 7,011 new cases per day.
It's like radio silence.
Katie Deck is a member of the Michigan Parents Alliance for Safe Schools. The group is calling on the state to take action to stop the spread of COVID-19 with mask mandates and quarantines of students exposed in all schools.
I don't know what the issue is, if we don't care or political reasons.
Governor Whitmer was acting under 2 state statutes back in 2020. There was the Emergency Powers of Governor Act and there was the Emergency Management Act.
Attorney Wade Fink says the governor does not have the same power she used to. One act would require the GOP-controlled legislature approve a time extension, and the other got thrown out in court.
Someone needs to step in and do something because it's overwhelming our hospitals again.
The leaders at Henry Ford Health System voiced concerns. However, last year, Michigan hospital leaders called for government action, and this time they're not.
You can debate whether or not there should be an action at the government level, but the reality is, as we've seen, it really is about getting people to all work on the same page to try and combat this virus.
I know 27 people who died of COVID-19 in my own life. I've never had a year and a half span like that.
Lieutenant Governor Garland Gilchrist says while the Michigan Department of Health and Human Services still has power in emergencies, the risk to the overall public has changed, and that everyone 5 years old and up has the power to protect themselves with vaccines.
At the end of the day, you have to make a choice for yourself. If you are going to be exposed to or contract COVID-19, I certainly would rather people be vaccinated than not vaccinated.
The Michigan Department of Health and Human Services did send out a press release this week celebrating that the state hit a 70% vaccination rate for residents 16 and older. It is important to note, though, that more people are now eligible to get vaccinated. Statewide, the vaccination rate when you include all residents is only 59%. In Detroit, Kim Russell, 7 Action News.
All right, thank you so much, Kim.